Welcome to Patient versus Post-Traumatic Stress Disorder. Introducing first, the patient, age 35, standing 5 foot 8 inches and weighing in at 180 pounds. And now, the challenger, post-traumatic stress disorder, dating back to the initial understanding of trauma. PTSD is known for its crippling depression and lingering anxiety. Today's battle is a repeat of the daily battle between the patient and PTSD. The constant fight has created a personality and perspective change for the patient. And now, today's referee to ensure a fair fight.
Dr. Stephen C. Hayes illustrates this empirically supported intervention. The goal of acceptance and commitment therapy, ACT, is to increase psychological flexibility, or the ability to enter the present moment more fully and either change or persist in behavior when doing so serves valued ends. Behavioral definitions. 1. Patient has experienced a traumatic event or series of events that led to a risk of bodily harm and/or a threat to life. 2. Patient reports feeling fearful or helpless based on a traumatic event. 3. Patient reports emotional numbing. 4. Patient reports nightmares, flashbacks, or intrusive thoughts about trauma. 5. Patient shows symptoms of hypervigilance, insomnia, startled response, anxiety, irritability, and/or difficulty concentrating. The patient's current distress comes from his emotions associated to a traumatic event that is related to a sudden death in his family. His spouse has become distant, and his support channel has evolved. He has grown more depressed and anxious, which has led to an increase in fear for his own life and associated nightmares. The patient will fight PTSD with the emerging psychotherapy treatment, acceptance and commitment therapy. Discussion of traumatic experiences is essential for people diagnosed with post-traumatic stress disorder.
Incoming. The patient's partner. Acceptance and commitment therapy, ACT, is a type of psychotherapy that helps you accept the difficulties that come with life.
ACT is an approach that aids a patient to accept painful experiences rather than attempting to fight or control his or her feelings that may be unpleasant. One can only start to address his or her own emotions after one has acknowledged his or her existence. God knows what is in people's hearts. ACT facilitates an inclusive approach representing an alternative framework of counseling that serves to counteract some of the potentially stigmatizing effects of therapeutic approaches for clients with mental illness. The effectiveness of ACT-based interventions for individuals with depression, anxiety, specific phobias and a range of other diagnosed mental health concerns has been demonstrated. The general goal of ACT is to increase psychological flexibility. Psychological flexibility is established through 6 core ACT processes. 1. Acceptance. Acceptance involves the active and aware embrace of those private events occasioned by one's history without unnecessary attempts to change their frequency or form. 2. Cognitive diffusion. Cognitive diffusion techniques attempt to alter the undesirable functions of thoughts and other private events, rather than trying to alter their form, frequency or situational sensitivity. 3. Being present. The goal is to have clients experience the world more directly so that their behavior is more flexible and thus their actions more consistent with the values that they hold. 4. Self as context. A result of relational frames such as I versus you, now versus then, and here versus there. Human language leads to a sense of self as a perspective, and provides a transcendent, spiritual side to normal verbal humans. 5. Values. Values are chosen qualities of purposive action that can never be obtained as an object but can be obtained moment by moment. 6. Committed action. ACT encourages the development of larger and larger patterns of effective action linked to chosen values. Basing the treatment of individuals off of the teachings of Isaiah 43:2. When you pass through the waters, I will be with you, and through the rivers, they shall not overwhelm you. When you walk through fire you shall not be burned, and the flame shall not consume you. Depression and anxiety that is related to a traumatic event will require acceptance to overcome. Understanding that you are not alone in your daily fight, you can continue until tomorrow. My working theory consists of combining the principle of continuance through faith outlined in Isaiah 42:3, along with the secular principles associated to the acceptance and commitment theory. By pairing these two ideals, balance and harmony can be achieved from even the most troubling of occurrences. ACT has been tested for workplace stress management, psychotic symptoms, mathematics anxiety, polysubstance abusing opiate addicts, chronic smokers, and social anxiety. Several of these studies have included measures of depression. An ACT-based group intervention decreased depression for self-harming clients who had been diagnosed with borderline personality disorder compared to a treatment as usual control. ACT views efforts to directly change private events with caution. The caution is based on a concern that these efforts might be co-opted into a generalized acceptance, and interrelated processes such as diffusion, mindfulness, and willingness play a fundamental role in ACT, and a complete array of methods is provided in the ACT manual to engage these processes. Epidemiological data from a large representative U.S. sample indicate a lifetime prevalence rate for major depressive disorder of 16%, or 30 million Americans will struggle with diagnosable depression. ACT conceptualizes depression largely in terms of contextually controlled avoidance repertoires. ACT maintains that the fundamental problem in depression is pragmatic avoidance, an unwillingness to remain in contact with particular private experiences coupled with attempts to escape or avoid these experiences. ACT is gender, faith, and race neutral. One of the main goals of ACT is to increase psychological flexibility, which refers to an individual's ability to connect with the present moment fully, as a conscious human being, and to change or persist in behavior that is in line with identified values. Clients are encouraged to shift their energies away from experiential control and towards valued activity, and to consistently choose to act effectively, even in the presence of difficult private events. The relatively inductive approach being followed also leads towards small and relatively short studies. The data so far seems supportive despite these limitations. But as the literature matures, it will be important to learn how to build these methods out into more comprehensive programs targeting the range of clinical needs being addressed. This research program is still very young, despite its nominal chronological age, since so much time has been devoted to developing the basic foundation of the approach. In conclusion, the combination of Isaiah 42:3 and the ACT principles could potentially gel to form a solid path to acceptance which can lead to recovery. Factoring the underlying pillars of each would allow for a faith-backed approach to treatment with a secular treatment method.